Hello everyone, welcome back on Meds. I'm your host Mr. Meds aka King Meds Nkosi yamakhambi xa ninibona nibothi azaneza. So today I want us to talk generics. I'm sure every time you go to the pharmacy you always hear about generics. Why do pharmacists always offer generics? What are these generics they are always talking about? Are generics fake medication? We will answer all these questions and more today. Before we can start with our topic today, please note that example of medication I will be using are only meant for educational purposes. All images or brand I will be using are not meant for promoting any brand or misuse of any medication. They are merely examples that I have selected because people might be more familiar with them. As a pharmacist, I exist in a space where brands' names do not exist. No brand is better than the other. My goal is to educate people about medication so that they can make informed decisions. So according to Section 22F of the Medicine and Related Substance Act, a pharmacist or any person licensed under this act shall inform all the members of the public who visit the pharmacy or any place of where dispensing might take place, as the case may be, with the prescription for dispensing of the benefit of substitution for the branded medication by an interchangeable multiple source medicine, and shall dispense an interchangeable multi-source medication instead of a medicine prescribed by the authorized prescriber unless expressly forbidden by the patient to do so. So in summary, this means that a pharmacist must inform the patient about the availability of generic medication, and they can substitute with cheaper generic unless the customer disagrees. So to answer the first question, this is why pharmacists always offer generics. This is because it is required by the law. So we cannot talk about generics without talking about the originator. What is the originator? The originator is the first brand that introduced the substance or the formula to the market. Examples include your Augmentin, your Telfast, or a Concerta. The originator company is responsible for researching everything about the drug. Those can be your side effects, your therapeutic indication, your toxicology, your dosing, and your contraindication about the substance or the formula. The originator company usually spends a lot of money developing the drug. So they are the first company to come into the market with the drug, so they spend a lot of money on the development. So to repay the money they use for drug development, the originator company is issued a patent to sell the medication without any competition. So this patent is only available for a specific period of time. So during this period, no generics will be allowed on the market. Only the originator will be allowed to sell this specific molecule. So now, once this patent expires, other companies will be allowed to make generics. Then the originator will be used as a benchmark for all the generics that will follow after. Now let's talk about generics. So after the patent of the originator expired, then other pharmaceutical companies are allowed to produce generics. Generics are medicines with the same active ingredient as the originator. So what is an active ingredient? An active ingredient or active pharmaceutical ingredient is the ingredient that has therapeutic effect. For example, in Telfast, fexofenadine is the active pharmaceutical ingredient. So this is the ingredient that has antihistamine effects, which means it is the one that helps with hay fever, rhinitis, itchiness, you name them. So generics are generally cheaper than the originator, but generics are not fakes. Generics are not fakes. Fakes are products that come into the country illegally and they are not regulated, whereas generics must go through various evaluation tests in order to be approved by SABRA to make sure that they meet the required standard. Those that do not meet the required standard, then they are not allowed to enter the market. During testing, one of the most important factors that is considered is bioavailability. Bioavailability is the amount or percentage of active pharmaceutical ingredient that reaches the circulation system after a specific amount of time. The bioavailability of a generic must be within acceptable range, because if the amount of active pharmaceutical ingredient in the blood is too high, then the generic might have more side effects than the originator. But if the amount of active pharmaceutical ingredient in the circulation is too low, then the generic might not be effective. So it must be within acceptable range for it to be approved as a generic. Now I want us to use the graph on the screen to analyze the bioavailability of generics to see which one qualifies as a generic. The graph in your screen shows the comparison between one innovator drug and the two generic drugs. The innovator product, which is the originator, as you can see in the screen, reaches a peak plasma concentration of 10 micrograms per liter in about 1.5 hours, whereas generic 1 reaches 2 micrograms per liter in about 1.5 hours. So this means generic 1 automatically fails the test. It will not reach the market because it is not bioequivalent to the originator, meaning it won't produce the same desired therapeutic effect as the originator. Then let's look at generic 2. So generic 2 follows the same pattern as the originator. It has a peak concentration of 9.5 microgram in about half an hour, and it follows similar pattern. This means that generic 2 is bioequivalent to the originator and it will produce same desired effect. So it qualifies it as a generic. Now this is not the only evaluation test required. There are other evaluation tests that the generic must go through to prove their efficacy and safety. Those might be your dissolution test, shelf life, and other tests. All these tests must be taken into consideration when evaluating the generic. So out of all the tests that generics have to do, they do not have to do the drug development test. That means they don't have to do toxicology studies, they don't have to do side effects, they don't have to do interactions, no need for contraindication tests, no need for dosing tests, because they are using the same active ingredient as the originator, which the originator already done an expensive study on. So as I said, the drug development tests are actually very expensive tests. So generic bypassing those studies, meaning that they can save a lot of money during production, and they already have a benchmark that they can compare to when they are producing their own generics. So it makes it kind of easier for them to produce a drug compared to the originator. So this kind of makes sense when generics start selling cheaper than the originator. So the other thing that the generic companies are allowed to change are inactive pharmaceutical ingredients. So inactive pharmaceutical ingredients are components of the drug that do not have therapeutic benefits. So these can be your fillers, your binders, your flavor, your colorants. With all these changes, the generic must still prove that the changes they made do not affect their safety and efficacy of the drug. So all in all, generics might look different, they might taste different, but they must still have the same effectiveness and the safety as the originator. Now I want us to compare the excipient of two generics with the originator. So the originator is going to be Telfast with two generics, which is going to be Fexo, one of the most common generics, and Polofast, one of the cheapest generic. If you look at their list of excipients, all three ingredients have the same active pharmaceutical ingredient, which is going to be phenolphthalein hydrochloride, 180 milligrams. So that ingredient must remain the same throughout all generics. No generic is allowed to alter that ingredient because it is the one that has therapeutic effect in your body. And then if you go to the list of inactive ingredient or list of other excipient, you can see that the Fexo and Telfast do not contain sugar, so they are sugar-free tablets, whereas the other generic, which is Polofast, has sugar, which is lactose monohydrate. There are other changes that other generics made. If you can see this, the starch, the maize starch, Fexo and the other generic Polofast use the maize starch, while the originator use pre-gelatinized maize starch. Other excipients are also similar, but you can see that Telfast has colloidal anhydrous silica, while Fexo doesn't have that ingredient because it's not a requirement. And if you can check at the generic as well, the generic used about two colorants. It's the iron oxide, the yellow one, and the iron oxide, the red one. Combine those two ingredients, it means that the tablet will be a pink tablet. Whereas Fexo use iron oxide, the yellow one, so that means the tablet will appear as yellow as well. And then the Telfast, I assume we also use the yellow one because it's the same iron oxide code as the one in Fexo. So you can see how this company play with inactive ingredients to try and bring the price of the product down. As I said, although these companies are allowed to make all these changes, they are not allowed to make any changes on the active ingredients. So that means they still have to prove that their product is as effective and safe as the originator. So most generic are of the highest quality, so they are very comparable to the originator. So it is important for a generic to make their product to be the best quality because their reputation is on the line. Basically, generics push themselves to be the best in the market. So there is no time for mistakes when you are a generic in the market. So although you are generic, you should push to be the best product in the market for you to have the better share on the market. Now I want to show you a clip of a video I saw online. I want you to watch it carefully.
Is rejecting your liver.
I've been taking my medication.
You've been on Asimipro since your transplant. After about 5 years, it can tend to lose its efficacy. I'm going to switch you to hepatocycline, top of the line, just approved by the FDA. Pretty much zero side effects. We'll start you on a mega dose in an IV right now, and then we'll send you home with some pills.
How much does that cost?
With insurance, maybe 20 bucks a month.
No insurance.
You don't have insurance?
Correct.
Then you're looking at $2 grand a month.
What, a month?
You could do the generic, Hepazone C, been around since the 70s.
How much is that?
Around 30 bucks a month.
Great. Start me with a mega dose of that, throw in some Vicodin, and my interracial friends and myself will be on our way.
I need to go over the side effects with you before you decide that Hepazone is right for you.
I never met a drug I didn't like, but it hit me.
Here we go. Sporadic blindness.
Blindness?
Paralysis.
So as you see in the clip, first of all, this is false. The generic and the originator cannot have different side effects because they have the same API. So if it happens that the generic have different side effects from the originator and those side effects are undesired or they have never been seen before, then the product will be recalled from the market. So it won't stay on the market. It's not allowed to stay on the market. It will be recalled from the market immediately. Now, price-wise, yes, it is possible for the originator and the generic to have a huge price difference. The longer the product is available on the market, the more generic you usually get. And the cheaper the generic become with every new generic coming into the market. A product can have more than 20 or more generics. There is no limit on the amount of generics each product can have. Some of the molecules have been in the market for so long to a point that the originator is not available anymore. For example, paracetamol has been in the market for very long to a point that the originator does not exist anymore. One of the most common paracetamol brands that people think is the original is Panado. Panado is not the originator. It is also a generic. Allergex is also not the originator. It is also the generic. The originator died long time ago. So you see, generic can be more recognized than the originator to a point that people think that the generics are originators. To conclude today's video, all I can say, thank God for generics. I think they created a very competitive market, preventing monopolization of this industry. If generics were not available, the average South African would not be able to afford medication. So this means we will be denying their right to health. As we all know, we live in a third world country with more than half of our population struggling to make ends meet. So generics plays a very important role in our health and economy. The average South African can now save on generics, and the government in the public sector saves a lot of money as well in generics. So even if you don't believe in generic or you only believe in originator, the availability of generics in the market create a very competitive space that the originator brands can monopolize the industry, and you get a very competitive price. Some of the originator brands at some point have to reduce their price to compete with the generic. So availability of generic is a good thing in South Africa, and there is also a market for both generics and originator. All I can say for now is stay on meds for more clarity, not confusion, one med at a time. I'll see you on the next video.